breast cancer, the things that we think about, but perhaps feel more comfortable asking in these comfortable confines of your home, office, or wherever you may be enjoying today's YouTube conversation. Before we begin and I introduce Dr. Latif, I'd like to point out a few things to help us as we chat with Dr. Latif further on in the program. So as you see on your screen, there's some instructions for how to use your YouTube chat if you're unfamiliar and have not used it before. So please take a moment. In your chat feature in YouTube, you'll need to make sure that you have your Gmail account and a YouTube channel. So here are your options for how to make sure those are accessible to you. First, sending questions via the chat feature in YouTube. You'll check to see if you're able to send messages by simply hovering over chat. If you see the sign in to chat message, you'll need to sign into your Google Gmail. If you're already signed into your Google account, what you will see when you hover over chat is create a YouTube channel. Simply pick a name that you wish to be associated with during this chat, and it will set you up for this chat conversation. Just again, keep in mind that whichever name you choose for that channel, it will appear in the comments section. Later in our conversation with Dr. Latif, you'll also have an opportunity to not only provide your chat questions via the chat, but you can actually join Dr. Latif on the conversation stage and ask her questions personally. And we'll talk a little bit more about that when we open up to conversations. So I'd like to start our time this morning as we all settle in with an introduction of Dr. Latif. Dr. Asma Latif is a board-certified medical oncologist and hematologist with Sturdy Health, and she also serves as our Director of Breast Oncology. Her clinical practice is dedicated to caring for people with various forms of cancer while specializing in breast and gynecologic cancers. Dr. Latif also cares for women who are at high risk for developing breast cancer, partnering very closely to help focus on a pathway of prevention and staying current and updated on things we can do to keep ourselves healthy. Dr. Latif is proud to be a part of the Sturdy Health multidisciplinary team and dedicated specialists that come together with cutting-edge, personalized, and compassionate care to deliver this service to our community. In her free time, Dr. Latif loves playing with her two young sons, additionally hiking, running, swimming, and spending time on the beach. So without further ado, it's my privilege to introduce Dr. Asma Latif as we talk about the personal side of breast cancer. Good afternoon, Dr. Latif.
Thanks so much, Justine. I really appreciate that introduction. And I'm so happy to be able to spend some time here today talking about a topic that's very far reaching for patients with breast cancer, and yet often not discussed enough because it's a very private topic. The personal side of breast cancer refers to those intimate changes that people with breast cancer experience, not only as a result of the diagnosis, but of the treatment as well. And during this talk, I hope to touch upon some of those symptoms and side effects. But after that, I'm looking forward to being able to field some questions and comments from everyone who's listening, with the hope that we can share our collective experience with this group and each other. Whenever we're ready to get our slides up, we can get started. There we go. Next slide, please. So I want to start by actually reviewing the degree of impact that breast cancer has in our society. As many of you are aware, aside from skin cancer, breast cancer is the most common cancer diagnosis in women. Almost 300,000 people this year will be diagnosed with breast cancer in the United States. In the past, before breast cancer screening, a lot of people who were diagnosed were found to have cancer at a late stage and didn't have very many options. Modern mammograms were developed in the 1960s and were officially recommended as a screening test by the American Cancer Society in 1976. This, as a reminder, is the best studied and only imaging technique to be able to reduce our risk of dying from breast cancer. And so, not surprisingly, as more and more women began to get screening mammograms, the number of diagnoses of breast cancer in this country went up. We were able to pick up breast tumors at smaller and smaller sizes, especially as mammogram technology has gotten better. And as we've added sometimes ultrasound and MRIs of the breast to screen as well. So the idea behind early detection is that when cancers are found at a smaller size in the breast, they're going to be much easier to treat, less extensive surgery, less aggressive medications. So over the years, not only have the screening techniques gotten better, but surgery and radiation techniques have improved, and our medications have improved. We have chemotherapy, of course, but now for some women with breast cancer, we can use immunotherapy, which essentially harnesses one's own immune system to fight cancer cells. We have anti-estrogen medications that block estrogen that's needed by many cancer cells. And we have a group of medications that are referred to as targeted therapies. And basically, these can hit cancer cells right where they're vulnerable. So, as a result of these advancements, more and more people are being cured of their breast cancers. And if they do have advanced breast cancer, they're living longer with it. This means that we have more breast cancer survivors than ever before. Can we go to the next slide, please? So that word survivor gets used a lot in this context, and especially in the month of October. But the question is, what exactly is survivorship? The National Coalition of Cancer Survivorship defines this as a broad experience in the cancer journey, anywhere from living with, through, and beyond a cancer diagnosis. So basically, anybody who is diagnosed with cancer from that point forward is considered a cancer survivor. Right now in this country, we have 18 million cancer survivors. And people who have breast cancer or have a history of breast cancer make up 40% of that 18 million. So this is clearly a huge number, and we recognize that this group of people require great care. We have to meet the needs of survivors so that they can thrive and, return to good health. Whenever we talk about survivorship, though, it brings on a second question in my mind, which is, what are the complications of survival? So we can go to the next slide, please. All right, so the complications of survival, in my mind, are the lasting effects to the mind and body due to the cancer and the treatment of the cancer. I'm sure everyone who's listening can attest to the fact that a cancer diagnosis affects every part of their body and mind. Many of those effects are temporary. They improve and go away after a period of time, but there are lasting effects that really can impact one's quality of life. This picture highlights a little bit of what I'm referring to. So, for example, a person who has breast cancer may receive surgery, radiation, chemo, and other medications. All of that can lead to things like emotional and neurologic symptoms like depression and anxiety and neuropathy. There can be side effects from surgery like lymphedema or pain. There can be symptoms related to digestion changes or menopause side effects. And some of these can last and become chronic. And so that's what I consider the complications of surviving that cancer. We can switch to the next slide, please. All right, so I think this next image demonstrates some of the internal conflict that so many of my breast cancer patients experience. During breast cancer treatment and beyond, there's one part of you that is, the part that everybody sees. That's the tip of the iceberg. But what people don't realize is there's the entire iceberg below the surface. That's the rest of you. That's the part that people may not understand. The emotional effects that you've experienced from breast cancer treatment, the effects from surgery, from chemo, from medications, all those hidden experiences that can really impact, the relationships. They can impact family members and loved ones. They can impact, productivity and satisfaction at work. And they can impact your intimacy with your partner. It's all of that that leads us to recognize that we have to address these complications. So today I want to touch upon a few of those more personal or intimate effects, but by no means is this discussion going to be comprehensive. And so I look forward to hearing more, during the question period. We can go to the next slide. Thank you. So first up is hot flashes and night sweats. These are tough for anybody who's going through menopause, but they can be especially difficult especially for women who are undergoing breast cancer treatment. Hot flashes are essentially caused by changes in hormone levels in the body. And when it comes to breast cancer treatment, this could be related to anti-estrogen medications we use, like tamoxifen, estrogen, letrozole, anastrozole, or fulvestrant. We can often see hot flashes develop in younger women who we essentially push into menopause with chemotherapy or suppression of their ovary function. And so regardless of what causes these symptoms, they can essentially, that changing of the hormone can essentially make it difficult for your body to regulate its temperature. And as many people are well aware, that can be really uncomfortable. It can happen at inopportune times when you're at work or in public or at night when you're trying to sleep. So the first thing to try to do is try to understand what triggers your hot flashes. While hot flashes can come up even without triggers, there are certainly some things that can make them more prominent or more frequent or more severe. For some women, that's eating spicy foods, drinking lots of caffeine, or even drinking alcohol. We know that stressful situations can increase the severity of hot flashes and the frequency of hot flashes. It's not easy to lower your stress, but recognizing that that's contributing can be the first step. So, once these triggers are identified, trying to address them individually can be helpful. Anytime you know that you may be prone to hot flashes, being able to control the room temperature is always a plus. Being able to have a fan available or have layers that you're wearing that you can shed can be helpful as well. We know that for women who are experiencing a hot flash in the moment, something called paced respirations can be helpful. So really controlling your breathing and paying attention to your inhales slowly and slow controlled exhales can be really helpful in trying to decrease the severity of the hot flash you're experiencing in that moment. One of the best ways to counteract hot flashes and to decrease how much they affect your life is by engaging in regular exercise. So regular cardiovascular exercise, trying to get to at least 150 minutes a week, but really making it part of your daily life is so important. And then specifically, yoga has been proven to be effective in decreasing hot flashes as well. For anybody who's a little bit more adventurous, we know that acupuncture can also reduce not only the frequency, but also the severity of hot flashes. So there was actually multiple studies looking at women with a history of breast cancer who participated in acupuncture sessions twice a week for several weeks in a row. And there was an objective reduction in their symptoms with that. And then, like in almost every circumstance, if someone is overweight or obese, losing weight can help as well. So some women try all of these or many of these strategies and still are suffering. So at that point, it's really important that you speak with your oncologist. I want my patients to come to me and tell me what they're experiencing. Sometimes if it's related to an anti-estrogen medication that I have prescribed, we have other brands we can try. For some reason, some people just mix better with some medications than others. If that's not an option, there actually are medications that can lower hot flashes. So we can actually start a medication if we have to that can decrease the severity and frequency of hot flashes. So a few of these include citalopram, venlafaxine, which is also called Effexor, and gabapentin, which is also called Neurontin. If we end up going down that route, we of course discuss whether that makes sense for that individual person. We often start at a low dose and then we can escalate up if we need to. So the most important thing to remember is that we do have a lot of options, and it's just a matter of finding what works best for you. All right, we can go to the next slide, please. Thank you. So I'm going to move on to another very common side effect from breast cancer treatments, which is vaginal dryness, vaginal pain, or irritation. The medical term for this is vulvovaginal atrophy. And as you can see in this picture on the lower left side, we can see normal vaginal tissue that has a thick and moist lining. So as that lining thins out and dries up, it can cause a lot of discomfort. That happens naturally through menopause, but unfortunately, we speed that up and we can make it worse with breast cancer treatments like chemo and anti-estrogen medications. Not only can it be uncomfortable for women, but it can also lead to yeast infections. It can lead to increased urinary infections and pain with intercourse. So I'll be, even from my own experience, I can tell that most women don't want to talk about this. It's not super common for people to bring it up, but it is so important to discuss because this is a really big impact on your quality of life. So typically, if this is happening, our first step is to recommend non-hormonal moisturizers to the vaginal area. So these are often water-based products. One of the common ones that works well is over-the-counter called Replens, but other brands work just as well, KY and other brands that are available. If these moisturizers are used in the vaginal region on a regular basis, multiple times a week, oftentimes that tissue kind of absorbs that moisture and it feels much better. So a lot of women can feel relief just from that. Additionally, if you're concerned about dryness and pain with intercourse, then you can add a lubricant on, and there are multiple brands. Again, Synergy or KY makes great lubricants that can help in terms of that comfort as well. So some women may try this and still feel a lot of symptoms and still feel really uncomfortable. So then we have to consider the next steps. It may be appropriate to discuss with not only your oncologist, but also your gynecologist, whether a low dose vaginal estrogen treatment is appropriate. These medications can work really well to reduce irritation and dryness. While they are estrogen based, we have some limited data that tells us that although they can increase the estrogen level in the bloodstream slightly, for women who are at low risk for their breast cancer to come back, these medications are probably safe. So while there are some theoretical risks, the benefits of these medications can be quite profound. So it's a real, individual conversation to have with your oncologist, whether this is a safe option for you. Additionally, if we do consider starting one of those estrogen-based treatments, it's important to remember that we can often use really small doses, just a couple times a week, for a number of weeks, and then people can take a break from it. And so the benefit that one receives from a short period of treatment can actually last. Beyond moisturizers and local treatments like estrogen creams, there are a few new options. So some of you may have heard of the Mona Lisa treatment or vaginal rejuvenation. This is essentially like a light laser treatment that's delivered to the vaginal tissue. And what it does is it actually damages the vaginal tissue and triggers the vagina to essentially create new, healthier tissue that has more collagen, that's more moist. And it has been shown to improve symptoms of dryness, irritation, and pain. It's non-hormonal, which is a huge advantage, but it's not typically covered by insurance, and it can be a little bit pricey. It requires at least 3 treatments along with a maintenance regimen. But this is an option for some people, and certainly if one of my patients was interested, we do have some good local resources where we can get this done. Some of you may have heard of Osphena, which is a non-hormonal pill that has been approved specifically for vaginal dryness and pain with intercourse. Initially, when this was approved, it came with a warning that women with breast cancer should not use it. There are no long-term studies for us to tell whether this is safe or not in that population. Although I will say that some limited experience suggests that it could be safe. But until we have those more long-term studies, I'm still recommending that my patients hold off on that pill. All right, we can go to the next slide, please. So now I'm going to move on to another topic that women tend to want to talk about even less than vaginal dryness. And this is, the concept of their sexual health. Breast cancer can have enormous impacts on sexual health and well-being. You know, First, understanding what that term even means is so important. It's interesting. So the World Health Organization defined it as a state of physical, emotional, mental, and social well-being in relationship to sexuality. This is so important to focus on because someone's sexual health can be a big component in terms of their quality of life and in their relationships. And when it's not there, it can have a really negative impact. As many of you are well aware, breast cancer affects every part of your mind and body. And so it's only natural that this area can be affected as well. We can go to the next slide, please. So I know the writing is a little bit small on here, but I just want to briefly summarize some of the ways that breast cancer can lead to problems with sexual health so that we can better understand it and come up with solutions for the future. So for example, cancer surgery can be very difficult when it leads to body image concerns. Changes in the breast contour, the size, the symmetry, scar tissue, texture, or even having the whole breast removed regardless of reconstruction can really impact someone's self-confidence. Surgery can also lead to changes in the sensation of touch in the breast region and around the nipples. And sometimes we see complications like lymphedema. Chemo and anti-estrogen medications can, of course, contribute to menopausal side effects and some of the vaginal symptoms we already discussed. There can be changes in body image if someone loses their hair or gains weight. And so the take-home point is that there are a lot of treatments that have far-reaching effects, and it's only natural that these can impact how a woman sees herself and how confident she feels with her partner. Next slide. All right, so I included this picture because I really want to emphasize what the next step should be if you're at home feeling this way. Communication with your oncologist is vital. This is something that both patients and providers tend not to bring up. Most physicians don't bring this up with their patients, and I can even fault myself for that. So this is something we need to, be aware of. And if you're feeling some of these symptoms or side effects or emotions, we have to make sure it doesn't fall to the bottom of the list of everything that needs to be discussed during an appointment. It's okay to advocate for yourself. And, even just in preparation and doing this talk, I am going to make a bigger effort to even bring it up myself with patients, just do a check-in with my patients to see if this is something that is concerning to them. So we can go to the next slide, please. So what can be done if you are having some of these issues? Obviously this could be an entire, week-long session for us to really delve into. But first and foremost, we really have to try to understand what is it that's affecting your sexual health. Is it an issue with desire or libido? Is it discomfort, vaginal dryness? We touched on, some of the solutions for vaginal symptoms with moisturizers and lubricants. There is a type of treatment called pelvic floor physical therapy that certain physical therapists, even in our area, are trained in. And this can actually be really beneficial for women who have pain with intercourse. It's special types of exercises they do. Actually, the physical therapist can even measure the strength of the muscles in the pelvic floor to really strengthen them and get them to be a little bit more flexible. And we can see really, really good results with that. We know that if someone is experiencing mood changes, self-image concerns, potentially seeing a therapist, potentially considering, treatment if there is a component of depression or anxiety can help. If there's tension between you and your partner, then couples counseling or even discussions with a sex therapist may be appropriate. Um, and then, for women where they've tried a lot and still just don't have that libido, if they're feeling very motivated and interested, there are some medications that can potentially help to improve that feeling of just not having the desire. So, for example, bupropion, which was originally used as a mood type medication and has a few different uses now. There are some data to show that it can be helpful. Uh, a lot of you may have heard of some pills that have been approved in recent years that are erroneously referred to as the female Viagra. Those I would caution against. They have not been studied in women with breast cancer, so we generally don't recommend going that route. Really, the most important thing is just bringing up the concern so that there can be conversation with your medical provider, and then hopefully that'll open up communication with your partner as well. We can go to the next slide, please. So on this slide, I included a handful of resources that are available at our fingertips online. There are a lot of useful information on those sites, but please remember that your team here at Sturdy is here for you as well. So if there is anything that I touched upon that you might have questions about or want to discuss further, please feel free to reach out to me privately if that's something that's more comfortable for you. On a subsequent slide, you'll see my email address. So with that, I thank you for your time and attention. And at this point, I can open it up. Any questions from our audience?
Dr. Latif, what a wonderful conversation. Just I think allowing people to really exhale and have a space to be able to learn more and be seen, to recognize, first of all, that what you're experiencing is being experienced by many. And there's actually a way in which to approach it and things that can be done. I can just imagine, and we're getting a number of questions coming through to the chat. But before we do, I really want to take a moment to invite everyone to join Dr. Latif. Please remember, feel free to drop your questions into the chat. If you would like to join us on stage, you're more than welcome to. In the YouTube chat, we've dropped a link. You can click on that link and you'll be brought into the stage. You'll be on camera with Dr. Latif and you can pose your question directly. And then once you're finished, we'll actually have you step backstage. And what that means is you will simply be off camera, but you'll still be able to chat, listen. You won't have to return to YouTube, but you'll be right here with us. So Dr. Latif, if I may, we have a number of questions that are starting to come in. The first question that we have in the chat is, thank you so very much for making this conversation happen. It is very uncomfortable and sometimes you feel like you're on your own. First question is, what do you think about the bioidentical hormone replacement therapy that is advertised as being safe and beneficial, but is actually considered a supplement and not regulated by the FDA? What are your thoughts?
Yeah, that's a great question, actually. So bioidentical hormones are essentially, hormones that are quote unquote brought from natural, substances like plants, but they're still processed in a lab. So they're not, fully natural. They, as you pointed out, are not as closely monitored or regulated by the FDA. And so in general, there may be some roles for those in other situations, but in general, for patients who have a history of breast cancer, I recommend against them. We actually don't know what the safety of these medications are in our patient population, especially if they mimic estrogen and estrogen effects. We also are not always confident that what's being described on the package label is actually what you're getting. And so the biggest concern is not only that we don't trigger the growth of a breast cancer because of estrogen effects, but we also don't want that supplement or that interfering with the breast cancer treatment that's so important. So if that's something that anybody is thinking about, I would encourage them to speak with their provider, speak with their doctor. I always keep an open mind. I always look to see, okay, what is it that you're interested in? And then really try to have, as much data as I can to back up our thoughts on it. But in general, I would be nervous.
Okay,
Mhm.
thank you. Dr. Latif, kind of following that, there's a question about anti-estrogen. And the question is, do the anti-estrogen medications cause hair loss? And can anything be done for that?
Yeah, so that's something I actually hear a lot about from my patients, and I know it can be so frustrating. Uh, we, in general, most women, as we mature, we tend to have a little bit thinning of our hair. And sometimes these anti-estrogen medications, especially what I refer to as the aromatase inhibitors, that's the Arimidex or Femara, they can cause a little bit more of that thinning. For some people, it's not noticeable. For other people, it can be, much more noticeable and bothersome. In general, our goal is, of course, to be able to continue the medication. Switching to a different pill doesn't necessarily impact the hair too much, so it's not usually something I move towards. I generally like to check some vitamin levels, make sure the thyroid is functioning well, make sure the vitamin B12, the vitamin D level are okay, because sometimes those can contribute to hair thinning as well. But if we're not finding any other concerns, there is some research that topical minoxidil, which is Rogaine, can be useful specifically for breast cancer patients who have hair thinning due to these anti-estrogen medications.
It's
Um,
okay for us to use that, Dr. Latif?
yeah,
Well,
so it's safe to use. It's used generally twice a day, and it can take several months to see improvements. But it is more and more acceptable at this point, and so I would be comfortable with my patients doing that.
well, while we think about it, because I think that is part of it is, we're still women and we are still working women for a lot of us that are moving through our cancer journey. What about the things that you see about, hair restoration, either caps and combs and things?
Mhm.
Do they work and have you had any exposure to them?
Yeah. So one thing that kind of triggered with your question is the caps. So we actually, recognize that hair loss especially for women going through, for example, chemotherapy treatment, can be such a profound impact on their lives. Especially if they have young children or other relationships with people who, they're nervous about, that image. And so in the past, there were women who would actually decline the best possible treatment
Oh, wow.
because they didn't want to lose their hair. So now we have the availability of something called scalp cooling, where women can actually wear essentially a cap like it starts before, during, and after chemotherapy. It's hooked up with a tube through a coolant, and it actually decreases hair loss due to chemotherapy. So that's been a huge benefit. It also helps to the hair that is lost, because it's not perfect. It does help to impact like the regrowth of that hair. So from that perspective, we're seeing a big change now, and that hair loss isn't as scary for women who are needing to face chemotherapy. It's actually
Yeah.
approved. It's approved like in our guidelines to do that as well. And it's considered safe. Beyond that, beyond Rogaine, I think you have to be careful. We definitely don't want people to be spending a lot of money on methods or over-the-counter things that are not going to be effective. So if someone is having just a lot of hair thinning or loss, and we can't find like vitamin deficiencies or metabolic changes,
Mhm.
then oftentimes I will actually refer them to meet with a dermatologist and really get a nice evaluation to make sure there's nothing that we're missing. And if we do have other treatment options, to have a specialist involved.
Excellent. Thank you, Dr. Latif. We have one of our guests with you today who asks the question, are women at higher risk if they have reoccurring cysts or infections to have reoccurring cysts or infections while they're going through chemotherapy?
Um, are, uh, can you say the question again? I just want to make sure I
Oh,
understand.
absolutely. The question was, are women at higher risk if they have reoccurring cysts and infections?
Okay. So, and if that whoever submitted that question, if I don't answer it correctly, please feel free to ask a clarifying question. So, in general, in terms of breast cancer risk, if someone's going through chemotherapy and they have infections during treatment, occasionally, if it's a serious infection, we have to pause the treatment and allow the immune system to take care of that infection. Generally, small disruptions to chemo are not, anything significant to worry about, and it should not affect in any big way the efficacy of the treatment. In terms of the cysts, if the audience member is specifically referring to like breast cysts or breast infections, I'll say that those have not been shown to necessarily increase breast cancer risk. So if someone has, if someone just happens to have a lot of cysts in their breast or lumpy breast tissue that gets identified as cysts on, mammogram and ultrasound, just understanding that's there and is normal is usually enough. We often watch those women a little bit more closely if we have any concern at all, but it doesn't necessarily affect breast cancer risk. And infection, certainly, if there's infections of the breast tissue, like with mastitis, that some
Mm.
women can experience with breastfeeding, that is also not linked to breast cancer. So I hope I answered that question, but if not, please feel free to clarify.
Excellent. Thank you, Dr. Latif. Dr. Latif, we have one of our audience members, Kathy Haig, joining us. And Kathy, I understand you have a question for Dr. Latif.
I
Please.
do. First of all, I'd like to thank Dr. Latif for presenting this very informative session. My question is, do breast cancer medications cause weight gain?
Oh, such a good question. So this is, I would say, one of the things that my patients are most concerned about whenever we speak about starting anti-estrogen type medications. We're always hitting home that in order to reduce cancer risk, we got to keep the weight under, in the normal range. And if you're overweight and obese, you got to lose weight. But it is true that some of our treatments can actually make it easier to gain weight. And for anybody who has experienced like perimenopausal or menopausal effects in their body, you know that when you gain weight, it's really hard to lose it. In general, it seems to be a small amount that is gained, if it is gained at all with these medications. And oftentimes we can try to counteract that because we also want to encourage increased activity and changes in diet anytime we think about reducing the risk of someone's breast cancer either coming back or getting a new breast cancer. So for a lot of women, they're able to counteract that because they end up embracing a more active lifestyle, a healthier lifestyle where they're not, eating as much processed, sugar and red meat and things like that, and really focusing on staying healthy. But a little bit of weight gain can be seen. And, if we do notice that it's more than just a little, it's definitely something that I want to talk to my patients about. I want to, make sure they're as successful as possible with these medications and with their health. And so sometimes we do have to make adjustments. Mm-hmm.
Thank
Good.
you.
Thanks, Kat.
Thank you, Kathy. Dr. Latif, it's so interesting. I loved your slide about the tip of the iceberg, and when you think about these conversations, that it really is everything that works together to either prevent breast cancer or to help you navigate through your breast cancer journey. And Dr. Latif, we have one chat question for you. And that chat question is it possible or allowed to get pregnant after a cancer diagnosis? And what about breastfeeding?
Yeah. Oh, that's such a good question. So, oftentimes we think of breast cancer as something that affects mostly women who have already gone through menopause, but unfortunately, we do see a lot of younger women with breast cancer, especially these days. I've taken care of people in my career who are in their late 20s and definitely in their 30s. So a lot of these women have had have plans for, having children and either starting a family or growing a family, and that gets interrupted. Certainly, this is something to bring up right away with your oncologist if there is a plan to consider future children and
Mhm.
fertility, because that should be actually addressed really at the first visit with a breast cancer diagnosis. Oftentimes, our medications like chemo and anti-estrogen medications can affect the health of, for example, eggs,
Mm.
or affect our fertility in general. And so for some women, if that is something that they're interested in, we actually may recommend harvesting eggs and making embryos in advance. And we have a lot of resources to be able to help women do that. And there is actually a lot of funding available to help women do that because it can be costly. Beyond that, in terms of getting pregnant after a breast cancer diagnosis, it is possible. And women do it. And breastfeeding is okay as well. But it's all about timing. So in general, if there was a plan for a future pregnancy, I would encourage you to speak with your oncologist right away from the beginning to kind of think about what would be the most safe. In general, for women who have low risk breast cancer, cancer that we don't think is likely to come back, for those women, there may be safe ways to be able to get pregnant in the future. But a lot of it may depend on what the treatment plan is. For women who need anti-estrogen medications, those medications may be recommended for 5 or 10 years. And so interrupting those medications to get pregnant can come with ramifications. So we really, want to have these sort of personal conversations face to face and talk about, okay, what are the risks? What are the benefits? What makes sense for that person based on their particular cancer? We never want to stand in the way of somebody, growing their family or starting a family, but we also want to make sure that that person is fully, has a full knowledge of what their options are. But, I think, and it's such a personal decision, it can happen, but I think it's a lot of planning.
It's such a wonderful thing to think about, that in your consultation, it really isn't just about your life in this moment, but it's really about your future and what that can look like and how you partner on the planning for that.
Yeah, absolutely. I mean, we get real personal in our initial consultation. My staff members know that. We ask all sorts of questions. If someone's in there with a partner, I ask them right away because we want the partners to be on board as well, especially when it comes to fertility. We want to make sure that, we're being really transparent. We never want anybody to get pregnant while on chemo, while on anti-estrogen medications. And if they were to get pregnant, it should be, with some period of time passing while they're off those medicines. So we talk about birth control, if they're having intercourse, making sure that they're using, condoms and things like that. We have to be really forward with that.
Again, the personal side of your cancer journey. Dr. Latif, we have someone who'd like to join us on stage. Sandra, I'd welcome you to join us on stage and ask your question directly to Dr. Latif. Hi, Sandra. We'll give you a moment to take yourself off of mute, and you're welcome to ask your question. We're so happy to have you. Sandra, it appears you're still on mute.
Oh.
Well, while we help Sandra through that piece, I'll ask another question from the chat, Dr. Latif. What options are there, or what are my options if I'm not happy with how my body looks after my breast surgery? We think a lot about that with, the things you were talking about, intimacy and our our body image changes, but talk a little bit about that.
Yeah, that's so important because, even if we put aside everybody else, put aside our partner's opinions or what the general public will notice, we want women to feel good about how they look for themselves. And so that is so important. The first thing to remember is that after breast cancer surgery, there's a lot of healing going on. Your body can be swollen and bruised, and it takes time for that to go down and improve. So give yourself time to get used to that body, because what you're seeing right after surgery is a far cry from what it's going to ultimately be. But as time passes, if you're not feeling comfortable, so there are lots of non-surgical things that can be done. We partner with some various organizations and groups in the region who are really effective at being able to come up with amazing, products like prostheses and bras and different types of, clothing that can really help women to feel more confident when they're out and about. So that's one one option. If if it's a matter of the cosmetic outcome of the surgery itself and it's just not okay, we want to make sure that women feel whole. This breast cancer treatment is not about blood work or a CAT scan. It's about a whole person and kind of making you feel whole again. And so we get to partner with a lot of great plastic surgeons. A lot of plastic surgeons, this is all they do. They just focus on breast cancer reconstruction, and that doesn't necessarily have to be huge surgeries. That can be small changes to just give symmetry and things like that. So, I would recommend in that case that, we would set you up with somebody and you would see how comfortable you feel in that setting. You know, Insurance, this is, something that's considered part of breast cancer care. So many insurances will cover that as well.
It's a great thing to point out. And Dr. Latif, kind of tying into that, are these conversations about if someone would like to have breast augmentation post procedure, post therapy, are those conversations that you have ahead of time as well or plan for ahead of time?
Yeah, to some degree, and certainly myself to some degree, but especially the breast surgeon. She's definitely going to be, intimately involved in these conversations. So for some women who have just part of the breast removed, uh, oftentimes uh, we let them heal and see how everything feels over time, especially if they need radiation and that sort of thing. And then if there are asymmetries, if one breast is larger than the other, that's often been discussed in advance. Okay, there would be, possibilities to help with that in the future if needed. But certainly if someone is meeting the surgeon and there's a need to have the whole breast removed, then, unless someone's sure that they don't want reconstruction, we always recommend that you meet with a plastic surgeon and just talk about your options, because there are so many. There's implants and there's flaps, and there's also so many new things that plastic surgeons can do these days. So we say just go meet, have a good consultation, and really understand what are your options now, and if you decide not to have a reconstruction now, what are your options later. And it's always better to go into treatment knowing that there are fixes if you're not happy. It's unfortunately it's never going to be the natural body again. And but I think knowing that you can expect everybody to try their best, it goes a long way.
I think what's been so interesting in your conversation with us today, Dr. Latif, is options. There are many ways to approach what you're experiencing and the pathway that you're about to begin. So I think that that's can be incredibly reassuring on a journey that can be scary. So the next question we have for you is one that I think we think a lot, but we are afraid to ask. And I'm so glad that you brought that up for us. And that is it safe to kiss my husband while I'm going through therapy? Can we sleep in the same bed? Can we use the same utensils, the same bathroom? That can be unnerving for a lot of folks when they're going through chemotherapy.
Yeah, I mean, you hear that you're going to be getting these essentially poison in your body to kill cancer cells, and it can be really scary to imagine that that could affect other people. So in general, most of those things are safe. You're, you know, we do some teaching, and actually our nurses in oncology do a lot of teaching when someone is starting chemotherapy, just about closing the lid when you flush or flushing multiple times initially, you're making sure that your body fluids are, kept separate from other people. But in general, kissing is considered to be safe. Hugging, being close to kids and grandkids, that's all considered to be safe. The main thing is actually trying to protect yourself. So not to kiss if someone has open sores. We don't want you to get an infection from somebody else. Not to be close or intimate if the other person is sick, because if you're on chemotherapy, your immune system is going to be lower. Sleeping in the same bed, proximity is fine. And even intercourse is fine during chemotherapy. Number one, the thing that matters the most is, do you want to participate in that? You should never feel pressured into that. And that has to be something that you're interested and you feel up to. Obviously, you're going to be feeling a lot of different things, including exhaustion during chemo. So you want to make sure that that's something you want. But if it is, we generally just recommend that a barrier method is used. So for example, a condom or something of that nature. so that there's just less mixing of the body fluids, just in case there is any bit of, chemotherapy effect in your own body fluids. But it is absolutely considered safe. And it's something that, again, when we are talking about, for example, starting chemotherapy, there's just a million things to cover. And sometimes that gets, pushed to the bottom and not addressed. So absolutely fine to bring those questions up.
Excellent. So there's no need to keep away from intimacy, or I love how you mentioned, hugging and kissing your grandchildren and doing the things that bring you joy. It's just
Yeah.
really what you feel ready for.
Exactly.
Dr. Latif, we have a question from the audience, and this may be Sandra. She's having some technical difficulties. Her question is, do dense breasts affect my risk for getting breast cancer?
Great question. The simple answer is yes. So about 50% of women in this country have what we consider dense breast tissue. If you were to read your mammogram report, radiologists are asked to essentially rate the density of one's breast, A, B, C, or D. A and B is considered less dense. C and D are considered more dense. So about 50% of the population is more dense.
Wow.
We know just by itself that dense breast tissue increases the risk for developing breast cancer. Some studies go as far as to say that it's 4 to 5 times higher, although that's not completely clear because it's hard to isolate just that one risk factor. But the point being, not only can it increase the risk of breast cancer, but it also makes mammograms a little bit of a less than perfect test. No test is perfect. We'll start by saying that, and mammograms are certainly not perfect. But just like it's hard to see something in a dense forest, between the trees, it's harder to see a small change on a mammogram when someone has really dense tissue. And so for that reason, it's actually legally protected that women should be notified about their breast density and potential impact to the effectiveness of a mammogram. And mammograms, while they're always considered the gold standard and they should always be done once a year in that situation, it's important for women to speak with their oncologist, their PCP, whoever is kind of ordering their breast imaging, about whether it makes sense to also get something like an ultrasound or an MRI of the breast in addition to a mammogram. Because for women who have dense breast tissue, there is a recommendation just to consider supplementary imaging. That comes with, risks and benefits too. Ultrasounds and MRIs do not add radiation exposure. For an MRI, you have to get an IV, and you get contrast. Both tests can increase what we call false positives. So sometimes something can be seen on an ultrasound or MRI, and we say, gosh, we need to look into this more, and maybe we need to do a biopsy, and it turns out it was nothing worrisome. So there is some risk of that, but that's a really personal conversation to have with your provider and say, okay, does this make sense for me? So absolutely, it's important to be aware of your breast density so that that conversation can happen.
I was going to say, I think that's a really important takeaway is asking, because I can't say if I've ever really paid attention, but also to engage in that conversation. So we all need to make sure we know our breast density and that we have that conversation to make sure we're getting the right complement. And also don't forego a mammogram simply because you have dense breasts. Have that conversation with your primary.
Mammograms are still great tests. And like I said, in my talk, that's the test that has been proven to decrease the risk of dying. So that's always, the baseline test. But then some of these other tests can help. Yeah.
Excellent.
And it's that whole concept of breast awareness. We're not necessarily asking people to do a breast self-exam every month. That's actually, not the focus. It's just being aware of your breast cancer risk and what you can do to bring that down.
And again, you're inviting us to a conversation, not only the conversation with you, Dr. Latif, but a conversation with our loved ones, with our physicians, and just, again, having more information. We have another great question that's come up in the chat for you. What is the recommended age to start screening for breast cancer in women? I think you hear that more than once or twice a day, I'm sure.
Yes. And it can be controversial. So what I'll say is that this requires a conversation with your primary care provider, your GYN, or your oncologist, whoever you're seeing to do your breast imaging. So the American College of Radiology and the National Comprehensive Cancer Network, so that's the group that a lot of oncologists follow, the recommendation is to consider once a year mammograms starting at the age of 40. There are other groups that recommend starting later or doing them every other year. But the important thing to recognize is it all matters. You know, what this all depends on is what's your breast cancer risk. So if a woman is felt to be at average risk for breast cancer, then, you know, it is a conversation between them and their provider, kind of what their values are, when they want to start. You know, I tend to start sooner at the age of 40 because of probably the nature of what I do. And I think it's a really great test. But if someone is assessed to have a higher than average breast cancer risk, then, you know, we would really encourage them to start on the younger side and do their mammograms annually. And there's ways to figure out what your breast cancer risk is. It has to do, you know, there's no perfect model, but there are models that are available. One that we use a lot is called the Tyrer-Cuzick model. There's also something called a Gale model. It takes into account your risk factors like genetics and family history. It takes into account, you know, if you've ever had prior breast issues in the past, sometimes your height, your weight, your breast density, and some reproductive factors as well, which can impact breast cancer risk. If someone falls into the average risk range, which is about 12% over their lifetime, mammograms are fine once a year. And, you know, from my perspective, like I said, I generally recommend starting at the age of 40. But if someone falls into a high risk where their lifetime risk of breast cancer is greater than 20%, those women can often start doing breast imaging sooner than age 40, especially if they have a family history of young breast cancer in their family. And those women qualify for MRIs of the breast in addition to just mammograms. And so it's really important to have that conversation. So, you know, from my perspective and here at Sturdy, I run a high-risk clinic. And so if there are women who are concerned about their breast cancer risk, even if they've never had a diagnosis of breast cancer, I'm happy to see them. We kind of work through this together. We talk about ways where we can decrease somebody's risk and screen them better. I think it's so important.
Oh, that's fantastic. Dr. Latif, it looks like we have time for one more question. And this question applies to a number of us in the room, whether or not we have breast cancer or are on that journey. And it is about hot flashes. Are there any foods or vitamins I can use to decrease hot flashes? People give me suggestions, but I don't know if these home remedies are going to be helpful or safe to try.
Yeah, that's such a good question. And it's so tough because, you know, as we briefly chatted about, hot flashes are, you know, so pervasive in terms of affecting women. You know, in general, you know, we talked about some of the triggers, but specifically home remedies or supplements that can be used, I would say just always be a little bit cautious. There are things, you know, that have kind of in popular culture like black cohosh and, you know, things like that have been brought up. Number one, we have to be careful because what you're actually purchasing, again, is not FDA approved or controlled. And so there's not a lot of vigilance regarding what you're actually ingesting. So that's my biggest concern. Number two, is it going to interact with any of the medications you're already on? And, you know, and then there's been some concern about some of these, if they mimic estrogen, could they impact breast cancer risk? It's not clear. And the challenge is that there aren't a lot of studies. These are not medications that are regulated by the FDA. They haven't been studied very well. So it's not necessarily off the table, but what I generally recommend my patients to do is if there is something they are interested in, if it's a product or supplement, bring it to me. Let me see what's inside. Let me see what the label says. Let me do some. There's a great resource that Memorial Sloan Kettering Cancer Center has an app. It's called About Herbs, like HERBS. And it's a great app for patients and professionals. It's probably the best resource, in my opinion, for looking up supplements and seeing, okay, what are the potential risks? What are the potential benefits? Do I have to worry? Is it going to affect my liver, my kidneys? is this something that I shouldn't do because of my history of breast
Right.
cancer? Yeah. And so there are some research that says out there, but I would say, honestly, anything you're going to take, run it by your doctor.
Excellent. Dr. Latif, I think we could spend the rest of the afternoon with you, and it's just such a privilege and a pleasure to be able to bring our guests into the room with you and have their questions answered. And what I would like to share with all of you again is our incredible thanks on behalf of Dr. Latif and the Sturdy Health team for joining us on our first clinician conversation. And to remind everyone that if you have any additional questions, Dr. Latif is always there for you. And we'll pull up a slide at the end of the chat so you know how to reach out and connect with Dr. Latif, as well as visiting us on the website where you can find more information about breast cancer and all of our services. And we hope that you'll follow us on one of our many social challenges, as well as join us again for another clinician conversation in the future. And Dr. Latif, thank you so much on behalf of our community and Sturdy Health.
Thank
Everyone,
you. Pleasure.
enjoy the rest of your weekend, and thank you so much for joining us.
Bye, everybody.